right, this is our patient Jim, who just finished a procedure today in our office, and we would just kind of check back with him a little bit. It's been a little while now since he's been able to enjoy his treatment. So Jim, tell us a little bit about your treatment and what you're experiencing now.
Well, I started out, I had pretty severe periodontal disease and suffered on a daily basis with it, with pain, dull pains under the gum line, sensitivity in the teeth. Since the procedure, the removal of the teeth, the insertion of the implants, and the appliances installed on the implants, I'm leading a regular life and enjoying eating and improved aesthetics as a result.
So what has surprised you as a result of this treatment?
Well, it was relatively painless to have the procedure done, and the result is a very stable biting surface. My teeth they feel better than my original teeth.
One of the things when we started this treatment, you told us, we had a poster in our office of somebody who had really nice or pretty teeth, you said, a beautiful smile. Do you think you've achieved that with this treatment?
Absolutely. I think the result meets or exceeds my expectations.
Do people you work with or know you, can they tell, or has anybody made a comment?
A few of my closest associates, of course, they knew I was having the procedure and they tell me they look great. Other people never comment. I think they think they're real teeth.
What has changed in your life as a result of this treatment?
Well, I enjoy eating again. That's pretty significant. I enjoy enhanced aesthetics or enhanced appearance, pretty significant. And most important to me, less pain.
What would you tell patients who are considering having this treatment done about your experience?
I'd have to say, if you can afford to do it, do it. It's a great option. It's the ultimate option.
And I believe the option that you picked on your upper was to do a computer-aided surgical procedure. Can you kind of describe that for people, what that was in your opinion?
Well, as I understand, the equipment used to do the preliminary study on the facial bone structure, it allowed the doctor to place the implants where there was significant bone and avoid nerves and do all this without having to do bone grafts.
And you didn't have any incisions. I believe the appliance was placed the day we put the implants in, so you went home with a denture that was connected to the implants and no longer floating or irritating your jaw. Is that correct?
That is correct.
And did you have much discomfort from that surgery?
No, next to none.
What would you say about Dr. Evans, who referred you to Dr. Duello? How do you feel about his efforts towards your goal?
Well, as you know, it was Dr. Evans' possibly first procedure that he had done. And Dr. Evans was very, very conscientious of the work he was doing, and as a result yielded a very favorable result.
And I believe it was Harding Dental Lab that did the actual prosthetic work and worked with Dr. Evans, so they helped make the teeth. How do you feel about a laboratory that does this kind of work for you?
Well, of course, I'm very pleased with the result, but I will add that everybody else who's in the dental profession who's seen them since the completion has also been very impressed with the result.
And in closing, is there anything you'd like to say to us, my staff in our office, for working with you the last months in doing this?
Nothing more than thank you very much.
Thank you, Jim. And we hope to share this with other patients who are either considering or in the process of this treatment. And we find it's very helpful when somebody comes forward who has gotten a good result and can share their experiences with them.